Hey guys, Dr. Ryan here. This morning I was doing an evaluation on a new patient, 6 week old with torticollis. So, torticollis is a lateral flexion, so a tilt of the head, and the baby is holding their head in this position. We'll get into some more detail about what that means and what causes that. I had a chiropractic student with me, and the exam that we were doing was different than anything they had seen before. I thought maybe it warranted a quick video to help explain to parents a little bit what's happening with the torticollis, and also the chiropractors, so that they might understand a little bit better how to evaluate that situation. So a torticollis, or a wry neck, I've heard it called, or a congenital torticollis, is where there's a unilateral, so one side hypertonicity, which is tension in the what's called sternocleidomastoid muscle, SCM muscle. So it's a muscle that runs from the sternum and clavicle to the mastoid, so sternocleidomastoid. And if I turn my head like that, you can probably see one muscle running down here. What that is, that's the sternocleidomastoid muscle, and it's a muscle that joins those two areas, is involved in flexion, is involved in lateral flexion, rotation, and a torque of the neck in this general direction. Now, in a baby, when you're doing an evaluation, the first thing you want to find out is whether or not the cause is biomechanical in nature. And so, whether or not it's primarily musculoskeletal, biomechanical, and nerve system oriented. So the diagnoses that you need to eliminate are very rare, but you have to make sure that that's not the cause. Is going to be a traumatic fracture of the skull, and or cervical vertebrae, or the sternum of the clavicle. Now, I have seen 3 times in practice on evaluating baby that the clavicle was fractured. They missed it in the hospital for whatever reason, and so we found that. So you have to check for that. The other things really rare that could cause that kind of a contraction would be a neoplasm, or an infection of the brain stem or spinal cord up at the very top. Once those are ruled out and you're certain that there's a biomechanical nature that's causing it, what you want to do is look to first to the etiology. So the etiology, the most common cause of that is an in utero constraint. So there's a constraint on the baby while in the mom's uterus. That could be a positional constraint, as the most common cause. Either they're stuck in a position for an extended period, typically due to a subluxation in the mother's pelvis, sacroiliac subluxation, lumbar subluxation of the pubic symphysis joint. These are all the areas that in a pregnant mom I'll regularly assess to make sure that the baby doesn't have an in utero constraint. You're going to check the round and broad ligament for tension, and any challenge in any of those areas, chiropractors can lead to an in utero constraint. The other things would be a traumatic birth for the baby, so some type of trauma as they descend through the spinal canal, or through the vaginal canal, and or use of forceps delivery, vacuum extraction delivery. Those are all things that can cause the type of trauma that would create a torticollis. In the case history or the referral mechanism, it's frequently that the baby shows up as unable to feed off of one breast compared to the other, and an overall fussiness when going to the opposite breast. It could be other potential breastfeeding problems. First of all, have to be eliminated before you go through the chiropractic evaluation. So it could be just a breastfeeding challenge to look at there. But parents often observe that the infant also has a favorite head position when sleeping or lying in the car seat. That's a valuable question to ask during any infant exam. It may not always be visually observed by the parents or caregivers. A line of questioning to eliminate the possibility should always be routine in any case. It's also valuable to inquire the parents whether or not the infant seems to be sensitive around the base of the skull or around the neck area at all, the suboccipital area. Although the biomechanical patterns for congenital torticollis may exist at birth, there actually may be no evidence of it until somewhere around the time when the baby starts to hold their head up or get a little bit more head control, which in some babies can be at 2 to 4 weeks, and some even later. So in all likelihood, the chiropractor might be the first healthcare provider to identify the torticollis in those early days. The clinical picture is most often that the infant is laterally flexed to one side, and then the neck is rotated to the opposite. And so, or the neck is flexed to this side and is rotated to the opposite side. There may or may not be a presentation of like a cranial and facial molding on one side, so you might get flattening of the head either at the occiput, the parietal, the temporal bone, and you might even have an asymmetry already developing in the jaw, which that subluxation can create, which can also cause the inability to feed off of one breast or the other. When you do an evaluation of the skull, just to measure that, it's simple. Use a measuring tape to measure from the external occipital protuberance around to the midline of the frontal bone here. And you measure it on both sides just to double check your measurements. It's always a good idea to measure the whole thing. Obviously, the total should equal the sum of your two measurements. And that also gives you a starting point from which you can compare future measurements as it corrects later on. The other things that you can use to measure nerve interference would be like a thermoscope. You can use a Titron scanner, a subluxation insight scanner, an NCM device. I like the small, easy handheld ones. Either way, those are the types of things that you can use to assess for nerve interference. Passive range of motion testing, the infant will be a little bit rigid in the affected areas. They'll express discomfort or distress, even light palpation around that area. And then segmental motion palpation, chiropractors will be used to determine the primary area of affected segments. Scientific research shows that the cervical spine is involved in about 50% of the cases of congenital torticollis. In my experience, it's almost always the occiput, C1 or C2. So occiput, atlas, or axis that displays a main subluxation pattern. And quite often, not always, if you have a lateral flexion and a tilt, the subluxation will actually be on the opposite side of the torticollis. So if they're tilted to the right, subluxation is on the left side, and it's a left anterior atlas. So it's an anterior subluxation of the atlas on the opposite side to the SCM contraction. Upper thoracic segments, so the upper back are often biomechanically compromised as well. Examination of that for compensatory subluxation would complete the analysis. You can do a gentle suboccipital traction and stretching of the SCM muscle. It's of value clinically. It's not a chiropractic maneuver, but it's something that can be taught as a home technique to the parents, performed by very gently, but flexing the infant's neck to the side away from the torticollis. So if they're tilted to the right, then you're just gently easing it to the side away. And then you're also, if there's a rotation, you're also rotating it to the opposite direction. And you can just hold that for 5 to 10 seconds, slowly releasing it and repeating it, 3 to 5 times every 3 to 4 hours. And that can really help with stretching out that muscle. Depending on how long it's been there, it can help with that. The chiropractic adjustment is typically done using the hands, but it can be done using an instrument. You can use an instrument that looks like this. There's various instruments that you can use. You can use a pediatric toggle headpiece. You can use a sustained contact or a gentle adjustment. The chiropractic adjustment is very gentle in nature. Quite often when the baby receives it, if the baby's sleeping, they don't even wake up during it. So it's a very gentle procedure with no side effects, so to speak. A specific chiropractic evaluation by a trained chiropractor can be the first step in assessing and correcting the underlying cause of congenital torticollis. If you know somebody that has that, or if somebody has a baby that's having a challenge with that, have them go to a chiropractor first. We specialize in the nervous system, we specialize in the musculoskeletal system, we specialize in analyzing that, and we also specialize in correcting that. Hope you found this useful. If you have any questions, feel free to email me at drryan@insideoutchiro.org with any questions. I hope you found this useful in some way, and I hope you have a great day. Until next time, thank you.